What makes me optimistic about health informatics is really where we are in this space and time in the country. A lot of good things happening across the country, but more importantly, there's a lot of good pilot projects, a lot of good evidence of what we can do, what the art of the possible might be if we scale some of these projects. There's some great work being done in the U.S. that we can learn from. Great work in terms of home monitoring. You know, there's a great movement across the country to treat more people at home, more home care. And at the same time, we need the tools to be able to treat people at home, to measure, monitor, see those results, see the effectiveness, see the outcomes. So that's a great project. There's some good work being done out of Newfoundland that shows what you can do with big data, what you can do with merging various kinds of both structured and unstructured data to look at how we can treat people in the home and what kind of disease processes are best responsive to that. So there's a lot of good work going on across the country.
Well, I think the value of analytics in any field, be it health in our industry in terms of high-performance sport and helping Canada's athletes win more medals, it's about how do we make better decisions, and analytics really helps us make evidence-based decisions. So that's really the driving factor for us in terms of our partnership with Canadian Tire. They're data scientists, data geeks, data nerds, and they love and breathe data each and every day. So for them to be able to use their knowledge and expertise in a way that's helping Canada's athletes and coaches perform better going forward is a match made in heaven, frankly.
The discussion today, emphasized some what I thought were very important points. One is focusing on the patient. That's how we're going to. I mean, that's ultimately what we're there for: is to help these patients have better lives and be healthier, and to focus on them. For many years, the provider has been the focus of healthcare. They've been the king or queen of healthcare. And we've recognized finally that we need to look at patient outcomes. So, as we've looked at improving healthcare, we started off doing sort of process evaluation, because that was easy to do. We could identify the processes. But that has had great limits. We're now focused on outcomes for these patients. And as long as outcomes now are the measure of how successful we are, then we have a much better chance of making the transformation that is necessary. Healthcare is faced with many problems. Inefficiency. Every country in the world is concerned about how much they're spending on healthcare, how much is being wasted, and how relatively little they're getting in terms of benefit from it. So understanding where we can make those improvements, how can we make healthcare more efficient? And for instance, one of the ways is personalizing healthcare, looking at the individual and learning as much about that individual person as you can to help make decisions that are more valuable for that person. Up until now, we've sort of been making population-based decisions. If you're a diabetic, we're going to try this. But not all diabetics are the same. And the more we can learn about those patients and use all the data that's available out there to help focus decision-making that's going to be most beneficial for that individual, well, that has to result in overall improvement in healthcare and efficiency. So that's very encouraging to be able to think about that now.
I do think we really do need to think about how to make this more useful to patients and also how to engage patients in the whole agenda, development of the agenda and advancement of the agenda, because I think that will make it a better agenda and you'll get better results. There's been a lot of discussion here at this conference about how relevance and usefulness to the frontline clinicians is key to the success and adoption of health analytics. I think the same kinds of considerations need to be applied to the patient as well. We haven't spent nearly enough time thinking about, first of all, I guess how health analytics can be useful to patients and how there are possibilities of actually thinking of health analytics tools as resources that patients can use. So I think that's one thing we need to think more about. The other piece I think we've missed is really sort of bringing the patient into the discussions about making sure that we're addressing the outcomes that matter to patients. And I appreciate that, there's important medical healthcare professional decisions that need to be addressed, but I still think it would be very helpful for everyone, including patients, but also just in terms of having a better focus to things, to actually involve and engage patients more in the discussion about what it is we need to be addressing and how we need to be putting together our health analytics solutions.
So I think we'd like to use health information in the same way that you can check your Facebook page and see how many friends you have and see what they're doing, to be able to have individuals, patients, Canadians, to be able to access that information, their own information, and be able to make important health decisions based on good, reliable information. So you can count up how many friends you have, you can count up various pieces of information on your Facebook page. You'd like to be able to have your own lab data, your own interactions with your healthcare provider. You'd like to be able to have access to what's the best treatment options for certain kinds of conditions that's valid, i.e. accurate and reliable. These are the kinds of things that we can do now. We're not doing it in health yet, but that's what we want to do. Clinical metrics are really about numbers, so we're counting things. So if we're doing a certain number of procedures and we're seeing certain kinds of results from those procedures, that's very important for planning purposes. So if we know that there are a certain number of people in a certain area of a province or territory that have certain kinds of conditions, how we use that information to help design treatment that's almost customizable for those communities. So it's not about one size fits all. It's about how do we use information to customize the right kind of treatment for those communities.